Welcome back to Precision Medicine Insight series to take deep dive into the world of precision medicine from clinical perspective. I'm Dr. Manisha Khurana, and today we have Dr. Robin Khosa with us, who is senior consultant at Indraprastha Apollo Hospital, and he has got over 18 years of experience in the field of oncology. So, welcome, Dr. Robin. So, my first
Thank you.
So my first question to you is that how precision medicine is changing the traditional approaches to cancer treatment, and what is precision medicine, or to be more precise, precision oncology?
Look, over the years since the time I entered this branch, there was a set rules of treating a particular cancer. Obviously, each cancer had its own treatment, but there were just some simple rules to treating a patient, uh, considering surgery, chemotherapy, radiation therapy. We all know have been used for the treatment of cancer from last, I think, few decades.
Yeah,
But there has been a sharp transition over the last few years, especially the last decade and all, when a lot of molecular testing, lot of insight into the cancer molecular analysis have been done to study the real genetic insight into the causation of the cancer, the etiologies behind, the pathogenesis behind it, how the cancer spread, why and what route they follow. So all these have been studied in depth and extensively, and I don't think so it is the end of the study which has been done. It's a
correct,
continuous process which is being done over last so many years,
correct,
and there has been a lot of translational research which has been going on to study the real biology of the disease. Because if you see in your surroundings, you may have a early stage breast cancer patient, one living for 20 years, the other failing after 2 years.
right.
So it's the biology which decides in this patient what exactly is going to happen in the future.
Exactly. I fully agree with you. And that is why, we have so much emphasis on molecular testing and molecular diagnosis these days. So, what do you think is the importance of getting your whole genome testing or genetic profiling done?
Look, studies have been done, and then there have been validations to these studies to see are these tests authenticated. There is n number of tests
Right,
based on which are studying the genetic profiles, but not all are validated to be used in general public. Yes, you see here a lot from pathology labs that they can do this test or that test, but some are not validated, and some, even if they are validated, they don't have uh, actionable mutation. Which the word actionable mutation means, even if you find a mutation,
right,
does do you have a specific treatment or a medicine to act on that mutation?
right.
In many cases we don't have them, but yes, in there are a significant number which are being studied, and they have actionable mutation, that's a drug available for that, which can alter the course of that mutation and help us improving the outcomes of that disease.
Yeah,
Like, if I can give a closest example, is a BRCA1 1 and 2 mutation, where you have a drug available to act on these mutations. Not only it is a prognostic, it's a predictive marker. Predictive means it can change the outcome of your disease if you introduce the drug which acts on this mutation. Plus, it is very important to study the genetics,
yeah,
because there are some diseases which are genetically transferred
right.
to our offsprings,
Yeah.
and important to understand what are those mutations which can transfer, so that we act timely, not only within the patient, but we are very, very cautious as far as our offsprings are concerned.
Yes, that's correct. And this is what is the target, oncology. And I think so much research is going on and so much to do in future. So, how does precision medicine help in predicting the prognosis of the patient in cancer patient?
Uh, yes. Now, predicting basically all these mutations, we take a common example of the breast cancer, which is probably the most studied mutational cancer, where we have the ERPR, the hormone receptors, the HER new receptor, the BRCA mutations, which have been studied extensively
Yeah.
and which help you predict. You may say a breast cancer is a one single entity, but there are four different stages of breast cancer: an early stage, a locally advanced stage, a metastatic stage. And within these stages themselves, we have whole lot of mutational. So there is a lot of permutation combination with ERPR. A person who is hormone receptor positive generally has a better outcome. A person who has HER positive, we have some drug available. ERPR positive, we have hormonal medicines available.
Right.
Person who is negative for all these mutations, we call it as a triple negative breast cancer, has a poorer prognosis. Even if it is a early stage disease, the chances of failure are different.
Right.
Secondly, we have also seen in some advanced stages of breast cancer, we tend to use neoadjuvant therapy, but we
Right.
also know that somebody who is ERPR positive will respond less, while
Yeah.
a triple negative would respond much better to a neoadjuvant therapy, and which in case many cases we follow the protocol of chemo followed by surgery and then plus minus radiation. So these markers would help charting out the plan of treatment so as to improve our outcomes. Many molecular testings are now coming in endometrial cancer. We have a whole new molecular analysis which is coming and rapidly changing in the current last 2 3 years, and probably in another 3 4 years we will have a much better validation of the markers for endometrial cancers, and which will help us omit adjuvant treatment in the form of radiation in many cases. If those markers are positive, we would get an idea that these are low risk cancers, and we would probably omit radiation in patients of these mutations. Like a
Okay.
patient who have P53 mutation, even if it is an early stage, may somehow warrant some sort of adjuvant treatment because it is a poor prognostic marker. So these are some of the tests which help us in guiding the adjuvant treatment, neoadjuvant treatment. And that is principally the reason why we go for a whole lot of genetic molecular testing, because all the future, what we can say is treatments would be guided by these molecular analysis, and that is what exactly is the meaning of precision. Precision means identifying that particular molecular change in your body, in your cancer, and then guiding the treatment accordingly. It is not only linked to the there is a different form of a precision technology used for radiation, where you use a very small targets, you use stereotactic radiations,
Yeah.
which is another form of precision treatments in radiation therapy.
Correct. Correct. Fully agree. And this is what is customization according to an individual. So, what do you think are the challenges, in implementation of precision medicine, especially in India?
I think the biggest challenge is using the data which comes from West and applying it to the Indian population.
Yeah.
Most of these studies need to be validated. Our population genetics is slightly different from the Western population,
Right.
so we need to incorporate those factors. Strictly following molecular in the upfront setting may not be enough until unless we follow the entire protocol. Say
Right.
if the patient is not willing for an observation, strict observation, so skipping treatment based on molecular analysis sometimes becomes a risky situation.
Correct.
Secondly, so we need to be very cautious when we apply the same data to the Indian population. Obviously, these datas are also changing very rapidly. So that creates a confusion in the minds of the treating physicians, because sometimes even if these studies have been validated, after say 5 7 years, you may have a new study which may challenge that same. Yes, but we keep on updating ourselves with the current trends, and yeah, the maximum a physician can do is to keep itself updated and go with the current updated protocols which are followed worldwide. Secondly, the most important thing is availability of a uniform testing facility in the entire country. The metros may have both, most of them, while the peripheries lack most of the facilities. The costs are prohibitive in many situations. The labs are not all validated. We see multiple labs who propose that they are doing most of these tests, but all of them don't have the validated uh, testing methodologies available with them. So these are also challenging to what report to accept. There may be conflict in the reports many a times we have seen. And yes, sometimes the thing is, the cost prohibits, it's the cost of these tests itself prohibits a patient to go for these testing.
Right.
So I think over a period of time, we will have many more labs and cut price cut in these testings, which more and more people can acquire to.
Yeah. So the key is to make it more affordable. I fully agree.
Yes.
So with this, we come to the end of this episode. Thank you so much, Dr. Robin Khosa.
Thank you. Thank you so much.